And now to all the stories, the Ministry of Humanitarian Affairs, Disaster Management and Social Development has held its second training of emergency responders in the southern states of the country to assist in handling emergency situations in the various communities more effectively. The Minister, Sadiya Umar Farouk, who declared the training open in Ikeja, Lagos, said the capacity building initiative is aimed at training local community first responders to address specific needs of the vulnerable, mitigate the effects of a hostile environment on persons of concern, and handle the possible long-term impact of crisis in the various communities. The minister, who is represented by the Deputy Director, Humanitarian Affairs, Charles Anailo, stated that the training will serve as a platform for the exchange of ideas and experience sharing from field operations with a view to entrenching efficient and effective delivery.
This particular training is targeted towards building the capacity of community first responders on issues of emergencies with a context specific to migrant and migration-related issues.
Most disasters happen in the communities, and so that is why community is very key. And just as the name goes, community emergency response team. So this team has to be in place, and when they're in place, they have to sensitize the people. People will be educated, and they will be given some special skills, especially for as first responders to emergency. By so doing, it will build their resilience, thereby helping to mitigate the impact of disasters, especially arising from humanitarian emergencies or humanitarian issues.
But the resilience could also be geared towards the 3 levels of responding to emergency. The first part of it is preventing emergency. So we build the capacity of local communities to do what they call the early warning signs, to know when it's impending to happen, and then also to avoid issues or situations that could lead to them, conflicts, for man-made, and then environment, as the case may be.